Hi, I'm David Pope from Clinical Edge, and welcome to this week's 5-minute physio tip on diagnostic tests. Are they actually useful? So there's been lots of research coming out lately about whether diagnostic tests actually identify the specific structures that they're supposed to test and whether they do that accurately. So say for instance, does the empty beer can test out here identify supraspinatus pathology or tendinopathy? And that's how it's always been taught, as a test for supraspinatus. But no, it doesn't actually pick up whether there is a supraspinatus tear, tendon pathology, or other problem with supraspinatus. So what's the use of it? Is there any point in performing an empty beer can test if it doesn't pick up those specific structures? Another example that's commonly tested is the single leg hyperextension test. And that's commonly thought of as identifying lumbar stress fractures or spondylolisthesis. So does it do that? No. So it doesn't pick up those accurately as spondylolisthesis or a stress fracture. So is there any use in performing the test? I'm going to talk you through a couple of use case scenarios where all these special tests actually are useful. So for instance, we want to know with your patients, am I making progress with the treatment that you performed within that session or with the exercise that they've been performing in between your treatment sessions? So you could use the empty beer can test, for instance, as that assessment reassessment finding. So when you're in that position, you get a 4 out of 10 pain with resisted abduction. So now you've got a clear guidance on pain levels while performing that test. Then you perform some treatment or exercise, retest it, and you go, now you're at 2 out of 10. We've got starting to get a clear indication that is, the patient's heading in the right direction, that we're having a positive treatment outcome. Whereas if you get them back and they've got 4 out of 10, well, you don't know anything more about supraspinatus pathology, but what you do know is that you're not having the desired treatment outcome and you need to change tacks. So that's one really good example of how you can use your special tests as more of an assessment, reassessment findings than at identifying specific pathology. The other way you can use your specific tests, in this case your one leg hyperextension test, is as a return to play or screening test, or as an indicator for when your patients can get back to their sporting activities. So let's take for instance a cricketer, and they might have pain when they're bowling, and you've taken their bowling out because it's too painful. They've got pain during a one leg hyperextension test. Do they have a spondylolisthesis or stress fracture? Well, as we found out, no, we don't know that from these tests. But we can use that as an indicator to say, all right, when you can achieve 30 single leg hyperextension tests pain-free, you can start bowling again. So now we're using that as an indicator, and the patient then goes, okay, well, I can only achieve 15. They're really clear on when they can go back to bowling. They go, well, I can only achieve 15 without pain, and I need to achieve 30. So I've got to do more of these exercises you gave me so that I can build up and get to that point of 30. So you're giving your patients a clear indication, you've got a clear indication, and then you know when you can start to reintroduce those activities like bowling. Once again, you're going to incorporate, like you will always do, your load management principles of going, righto, well, you actually need to build up. You're not just going to go nuts and go bowling 20 overs, but you're going to build up your bowling once you've achieved this target, this key indicator. So there's some ideas on how you can use these diagnostic tests as important indicators, reassessment, assessment findings within your treatments. Know if you're heading down the right track or not. And they are actually useful. So I hope you've enjoyed this week's 5-minute physio tip, and have a great week.